Hello everyone, welcome back to our channel. In this video, we will discuss the pathophysiology of anemia, types of anemia, the signs and symptoms, diagnostic approaches, treatment modalities, nursing interventions, and patient education, hence providing a holistic understanding to facilitate effective management and care. Anemia, a condition marked by a deficiency in red blood cells or hemoglobin, significantly impairs oxygen delivery to tissues and organs, affecting millions worldwide. Pathophysiology. Anemia is a condition marked by a deficiency in red blood cells or hemoglobin, crucial components responsible for oxygen transport throughout the body. Its pathophysiology is complex and multifaceted, often stemming from disruptions in the complex process of red blood cell production, also known as erythropoiesis. These disruptions can arise from various factors, including blood loss from hemorrhage or chronic conditions such as gastrointestinal bleeding, decreased production due to bone marrow disorders or nutritional deficiencies, like poor intake of foods rich in iron and increased destruction of red blood cells, a condition known as hemolysis. Globally, iron deficiency is one of the most common causes of anemia, resulting from inadequate intake, absorption, or utilization of iron, a key component necessary for hemoglobin synthesis. Similarly, deficiencies in essential vitamins, such as vitamin B12 and folate, can impair red blood cell production, leading to anemia. In addition, chronic diseases such as chronic kidney disease, celiac disease, gastrointestinal bleeding, ulcers, inflammatory disorders, and certain cancers can also disrupt erythropoiesis through mechanisms involving inflammation, impaired hormone regulation, or bone marrow suppression. Types of anemia. Anemia presents itself in various forms, each characterized by unique underlying causes and pathophysiological mechanisms. Iron deficiency anemia arises from insufficient intake or absorption of iron, essential for hemoglobin synthesis and red blood cell production. Vitamin deficiency anemia results from deficiencies in vitamin B12 or folate, crucial for erythropoiesis. Hemolytic anemia occurs due to the accelerated destruction of red blood cells, often stemming from inherited conditions, autoimmune disorders, or infections. Aplastic anemia involves decreased production of red blood cells, which may occur due to bone marrow disorders or exposure to toxic substances. Sickle cell anemia, a genetic disorder, leads to the production of misshapen red blood cells that can obstruct blood flow and cause tissue damage. Each type of anemia requires specific diagnostic and therapeutic approaches tailored to its underlying cause and severity. Signs and symptoms. Anemia symptoms include fatigue, weakness, shortness of breath, pale skin, dizziness, headache, and irregular heartbeat. In severe cases, it can lead to chest pain, cognitive difficulties, and organ damage due to oxygen deprivation. Diagnosis involves a comprehensive evaluation, including a complete blood count, CBC, peripheral blood smear, and measurement of serum ferritin, iron, vitamin B12, and folate levels. Early recognition is crucial for prompt intervention and management. Diagnostic tests. Diagnosing anemia involves a comprehensive evaluation to accurately assess the patient's condition. Typically, this includes several diagnostic tests. A complete blood count, CBC, is conducted to evaluate red blood cell count and hemoglobin levels, providing essential information about the patient's overall red blood cell status. Additionally, a peripheral blood smear is performed to examine the morphology of red blood cells, aiding in identifying any abnormalities or irregularities. Measurement of serum ferritin, iron, vitamin B12, and folate levels is essential to identify deficiencies that may contribute to anemia. In select cases where further assessment is required, a bone marrow biopsy may be conducted to evaluate red blood cell production within the bone marrow. This comprehensive diagnostic approach enables healthcare professionals to accurately diagnose anemia and determine the appropriate course of treatment for the patient. Treatment options. Treatment for anemia varies based on the underlying cause and severity. Options include iron supplementation for iron deficiency anemia, vitamin B12 or folate supplementation for deficiency-related anemias, and blood transfusions for severe cases or acute blood loss. Medications to suppress the immune system or stimulate bone marrow production may be prescribed, and in severe cases, stem cell transplantation may be considered. Treatment should be aimed to address deficiencies and complications, and also tailored to individual patient needs and medical history. Additionally, in conjunction with medical interventions, dietary modifications and lifestyle changes are often recommended to complement treatment and optimize outcomes for patients with anemia. Nursing interventions. Nursing interventions for anemia consist of a holistic approach to patient care. This includes vigilant monitoring of vital signs and oxygen saturation levels to assess the patient's physiological status. Nurses' key role includes administering prescribed medications and blood products, ensuring timely and accurate delivery of treatment. Patient education forms a vital component of nursing interventions, with a focus on imparting knowledge about dietary modifications and medication adherence to optimize treatment outcomes. Additionally, nurses assess for signs of complications, providing timely interventions as needed, while also offering emotional support to patients and their families throughout the treatment process. Monitoring parameters. Regular monitoring of key factors is essential in managing anemia effectively. This includes tracking hemoglobin and hematocrit levels to evaluate the response to treatment and ensure optimum oxygen-carrying capacity. Vital signs are closely monitored to assess oxygenation and hemodynamic stability, providing insights into the patient's overall condition. Additionally, monitoring iron, vitamin B12, and folate levels is crucial to assess nutritional status and guide supplementation as needed. Observation for symptoms such as fatigue, weakness, and shortness of breath allows for early detection of complications and timely intervention to optimize patient outcomes. Patient teaching. Patient teaching plays a pivotal role in anemia management, empowering patients to actively participate in their care. This education should emphasize the importance of medication adherence and modifications to optimize treatment outcomes. Patients should be equipped with strategies to manage fatigue and conserve energy effectively. It is essential to recognize the warning signs and symptoms of increasing anemia or consequences. Encouraging patients to attend follow-up appointments ensures ongoing monitoring and support, facilitating the continuity of care and promoting overall wellness. Conclusion: anemia, with its multifaceted nature, underscores the importance of a comprehensive approach to patient care. By delving into its causes, types, and symptoms, healthcare providers can tailor interventions to meet individual patient needs effectively. Thanks for watching. Kindly subscribe, like, share, and press the bell icon for more educational nursing videos.